set it up onto the same one. So Amy's going to have some slides, and it goes going to go straight into your slides.
And you're gonna go.
It's all in the same time.
And I'll introduce you.
It'll be that you, whatever you say, you can just say my name.
All right,
I
perfect.
don't need any fancy.
Okay, you don't need any for. Am I doing this right now? Okay. Hey, look at that. And we're live. I will take the clicker from you real quick. Thank you, Leslie. All right. Hi. Who's having a great day? Thank you. Thanks for being here. My name's Amy Sharma. I'm the Executive Director of Science for Georgia. I'm really pleased. Apparently, Patrick is now a video director. He's doing great. Really pleased that y'all could make it here today to have this great talk we're going to have. So, usually I'm more exciting than this, but that's where we are right now. So, a few slides about Science for Georgia. We were started in 2018. We're a science advocacy organization. Well, thanks. So I'm really excited. Leslie's here to talk about his amazing program, which just had its 20th anniversary. And it's all about how we can make changes to get people out of a cycle of poverty. So, without further ado, Leslie Rubin, there you are.
I'm going to tell you about a program called Break the Cycle of Children's Environmental Health Disparities. And as Amy says, we just celebrated our 20th anniversary. And I'm going to tell you about how it all started. Everything I'm going to say is my own, and I've been supported by a number of organizations, and I'm grateful to them. What I'm going to start off is definition of health. I'm a pediatrician, and when I started medical school, we had the notion that you're a healthy person, you get sick, you go to the doctor, you get better, and you get on with your life. But the World Health Organization in 1948 said that the health is not merely a freedom from disease, but it is a state of physical, emotional, and social well-being, much more complex conceptualization of health. In the 21st century, which is where we are now, we're appreciating that health is not merely a state of physical, emotional, social well-being. It's a dynamic interaction between an individual and the environment. And the environment is not just the physical environment, it's the community environment as well. So our environment is everything around us. The things we see and the things we don't see. I also want to introduce you to the concept of social determinants of health, because health, again, is not merely the state of physical, emotional, social well-being. It's the interaction between the individual and the environment, and the elements in the environment are critical to health. Childhood experiences, safe housing, good education, good social supports, substantial family income to assure good nutrition, employment so you can have a good income, and communities that are supportive, and good access to healthcare services. Those are the social determinants of health, and that's conceptualization. Now, I am a pediatrician, and I'm a pediatrician who deals with children with disabilities. And in 1999, I started a clinic for children with cerebral palsy in downtown Atlanta. And this picture is one of our patients with cerebral palsy, and this person is an orthotist, and he's putting on a brace because this little boy had some tightness of his heel cord. So what happened was, we started this clinic, and in late 1990s, the inner city of many parts of the country were populated predominantly by poor African American people who'd moved in to the cities where the citizens had previously built the cities but moved out to the suburbs. So they left a shell of where the poor people moved in, lived in there, but they had poor services. So when I started the clinic in 1998, 1999, we collected a group of 260 children in our clinic, and we decided to do a survey. And what I was looking for as a pediatrician was what kind of medical problems did they have. Did they have seizures and orthopedic problems and eye problems, which they did have. But what we found was that there were many infants who had cerebral palsy who were premature, and that the explanation for some of their prematurity was that their mothers had used substances, tobacco, alcohol, and other drugs, and that the more premature the infant, the greater the likelihood that the mother was using substances. So that was finding number one. Finding number two was that the children were living predominantly with a single mother. So the dark area is infants living predominantly with a mother, and like 60% were living with a single mother. 20% were living with grandparents, 10% in foster care, and only somewhere between 17% of premature infants and 30% of full-term infants were living with both biological parents. Oops. So we then said, well, what's going on here? What's driving this picture of prematurity and living with a single mother? And we looked at some of the relationship between poverty and vulnerability, and we found in this study that in the National Institute of Medicine, that many of the poverty, three times as many births were to unmarried teenagers in poor kids versus in more wealthy populations. There was more child abuse, lead poisoning, depression, experiencing violent crimes, stays in hospital, a dropout of school, substance abuse, low birth weight. So we were dealing with actually the drivers of these the cerebral palsy, and the conditions of the children were determined by poverty. So we then created this cycle concept and said, you know what, we start off with poverty, poor community supports, you remember the social determinants of health, poor health services, poor education, and these young people who land up as teenagers then have nowhere to go, no sense of future, no role model, no good education, and they land up with feeling of what's the future going to be like, so they take drugs to feel better, and then they have sex to feel better, and the young women get pregnant, they don't have good prenatal care, they continue to use tobacco, alcohol, drugs, also risks of sexually transmitted diseases. The infants are born prematurely with low birth weight and sometimes with a fetal alcohol syndrome, and these infants are stressed, they're irritable, they have developmental needs, medical needs, and these mothers, these young mothers, are stressed. They also continue to take drugs, they lack supports, and they have increased demands by virtue of now having an infant who has great needs. So these kids then land up in foster care with the grandparents, single parents, neglect, abuse, developmental disabilities, and continue with a cycle of poverty. And in 2024, 2025, which is 20 years ago when we first started this program, we used the term disadvantage for social and economic circumstances, and disability, which was the outcome for the children. And what we decided to look at was which children were poor. And when we looked at that, it was the children whose parents did not have a good education. Without a good education, they couldn't get good jobs. They couldn't get good jobs, they weren't even employed. So 57% of parents who have less than high school degrees are poor, 48% are not working, and the family constellation of poor families is more single family headed, almost 50%. And then we said, where do these poor children live? They live in older houses with poor condition, with lead in their paint, and a greater risk for asthma. In fact, you saw on the previous statistics that 3.5 more times to experience lead toxicity, and twice as likely to get asthma, and sadly 3 times as likely to die from asthma than kids who are more affluent. They also live in unsafe neighborhoods with overcrowding, traffic, litter, food deserts, limited green space, crime, and they're more likely to be obese, 60% more likely to be obese, and increased risk of experiencing violence. So if you imagine these kids who live in these neighborhoods who can't go out because there's going to be violence and crime, so they stay home, and they watch TV. They don't get exercise because there's no green space. They live in areas where there's a food desert, so they have these convenience stores where they can get food which is high calorie, high salt, high sugar, and low protein and low nutrients. They also go to schools that are in poor condition. The schools are in such poor condition that there's some environmental hazards within the schools, and also they're less likely to graduate because they have teachers who are not as well paid. Because if you live in a poor neighborhood, the people there are poor, so the schools are funded by the taxes in each neighborhood, and if you're in a poor area, you're going to have low taxes, and you're going to have poor funding for schools, so you don't have enough for the buildings, and you don't have good teachers. So these kids are more likely to drop out and be unemployed, and sort of land up in that cycle of poverty. And when we look at all the factors that I've been talking about, we see that it's a cumulative impact. We're talking about poverty, and in this country as well, discrimination and racism. We're talking about environmental exposures. I spoke about lead. There's air pollution that causes asthma. There's traffic. And often these poor neighborhoods are near factories that have smokestacks that spew toxic waste. Where they live in unsafe neighborhoods with crime. And it's also complicated by climate change, which affects poorer areas to a greater degree, where they have heat islands. They live with stressed single mothers. They're insecure, they're anxious, they don't know where the next meal's coming from, they don't know if they're going to have to move, if their mother's going to pay the rent, they could be evicted. The education system is poor, and the healthcare access, quality healthcare access, is also poor. So with this collection of characteristics, we decided we would re-examine our cycle of health disparities and include many of these elements. So what we did was looked at limited education, limited employment options, and limited income, compounded by limited healthcare services, limited social capital, income insecurity, food insecurity, housing insecurity, limited green space, degraded built environment, crime and violence, and those emotional, psychological, physiological stresses are compounded by environmental exposures to result in the cumulative impacts, and these are the adverse health outcomes. Mental health outcomes of toxic stress, post-traumatic stress disorder, substance abuse, violence, asthma, obesity, diabetes, heart disease, developmental disorders, and poor outcomes of pregnancy. And we realized, if you have a look at this, it really is an intergenerational cycle. So, the big question is, can we make a difference? Absolutely. Positively. When I started the program in 20 years ago, actually, I got $10,000 to start the program. And I said to myself, what's Leslie Rubin going to do with $10,000 to fight poverty if Lyndon Johnson, with the whole federal resources at his disposal, could not win the war on poverty? So I said, whatever it is, we'll make a little difference and see if each little difference makes a big difference. And that's my philosophy. This is a mother rat and her offspring. Now, rats are mammals, and they look after their young, they feed their young, and nurture their young. And this is a story of a mother nurturing and grooming her young. And what rats do is they lick and groom their little offspring. And when they lick and groom their offspring, they assure that their offspring will continue. On the right-hand side, you see a mother rat, happy mother rat, her little offspring suckling on her. She licks and grooms them, and these go on to have low anxiety and high licking and grooming of their offspring. So these little rat pups, when they grow up, because their mothers looked after them, are going to lick and groom their infants. These rats who did not lick and groom their infants are neglected, and they turn out to have high anxiety, and they do not lick and groom their offspring. This is a classic epigenetic research that was done at McGill University more than 20 years ago, and it's just quite a phenomenal one, and really seminal in the understanding of epigenetics. So, what did they do? They took these little rat pups from their non-licking and grooming mothers, and they gave them to the nurturing mother, and what happened was they were licked and groomed, and they went on to lick and groom their offspring. So you can make a difference. That's the point. The point is, this is not inevitable that the infants will not lick and groom their offspring and perpetuate that negative cycle, but if you can break the cycle by giving them to the nurturing mother, and they will in turn nurture their offspring. This is a phenomenal program that was started in 1962 with over 100 poor children, and they grouped them into two, one intervention, one non-intervention. The intervention was that at age 3 and for 2 years, they would have 2.5-hour preschool program every day in the week for the year, and they would also have weekly home visits by the teachers to their homes. And what they did was follow them up at age 15, 19, 27, and 40. This is what they found. So the intervention group, who got the daily preschool education and weekly visits at home, are in the dark shade, and the ones that were controlled who did not get it are in the light shade. And remember, these are all kids that had similar characteristics, were compared to each other by income, by every other measure, and what they found was the following. first of all, as special education. The kids who had intervention were half as likely to require less than half as likely to require special education. They did 3 times more, they were 3 times more likely to do better than the 10th percentile in achievement. They were a third more likely to graduate from high school. They were 4 times more likely to earn $2,000 a month or more. They were 3 times as likely to own their own home, and they were twice as likely or more to never be on welfare as an adult. And what is not in the slide also is they were like maybe 10 times less likely to land up in prison. So, prison's very expensive, by the way, and it costs society incredible. The US has the highest prison population in the whole world, 700 per 100,000 population, and it just terrible expense. Anyway, the point being here that this research work was done by economists. And the economists found that for every dollar invested in 1962, they yielded $8 in 2010. So this was a yield that was quite astronomical in terms of investments. And if we can invest the money in the kids right now, we can see a long-term benefit in years to come. Another study that was also done by economists at Harvard and Columbia universities, they tracked 1 million kids from large urban school district from 4th grade to adulthood. And what they were looking at was if they had a teacher in their classroom who made a big difference. So this is a group of kids these kids were comparable. This group of kids in the solid line had a very high value-added teacher. And what they meant by value-added teacher is when that teacher came in the classroom, the kids' grades immediately went up. The teacher inspired them. She educated them. She gave them desire to learn. And what happened when these became adults 20 years later is they were more likely to earn higher income and all the other associated attributes of a better economic situation. So a teacher licking and grooming your little babies and getting a good education preschool are proven to have positive outcome. So how are we going to make a difference? So what I did was when I got the 10,000 and I said, what am I going to do with 10,000 that Lyndon Johnson couldn't do with the federal resources at his disposal, was that I would work with students who are bright and creative and tell them, develop a project that will break that cycle at any point. So what they do is they develop a program, they do a project, we work with them over the course of a semester. We bring them to Atlanta to present their projects. They write up their projects for publication. Our society benefits from the increased knowledge, and the students are now going to become future leaders in our society. Kevin will demonstrate. Okay, so this is these are the projects from our 20th annual Break the Cycle program, which we held just a month ago. And these are the project titles: Extreme Heat and Adverse Birth Outcomes in Rural Communities, Prematurity, Academic Readiness and Educational Success, Nutritional Knowledge for Children Living in Food Deserts, Lead Screening Rate Disparities in New York City Children, Utility Water Access and Waterborne Diseases in Children, Appalachian, Tennessee, Access to Healthcare Neighborhoods, Violence and Socioeconomic Status and Children's Health, PFAS, which is a forever chemical toxic to humans, and cardiovascular health in at-risk youth, climate change, water quality and child health in Flint, Michigan, youth-centered approach to poor air quality near schools in New York City. Oh man, what did I do there? I made a mistake. Okay. Students' perspective on environmental health in an environmental justice community, and a photo voice project and community engagement to advocate for change. So these were the projects from this year's cohort. It came from around the country, came from Chicago, New York, I don't know, like about 6, 7, 8 different places around the country. And together they were able to break the cycle. Now, over the 20 years that we've had, or this was from last time, we had 19 annual programs, 200 students, 54 university departments, 21 states in the US, 6 countries in Latin America, 2 countries in Africa. We had 18 international journal supplements and 18 books on public health. Now we have 20 actually. This was our very first international journal published. This was our very first book. And so we've now had like about 20 books. This is Break the Cycle, Maternal and Child Health Aspects. This was on environmental justice. This was on COVID. This was on climate change. And this is on cultivating future leaders. And with all this, we say, although we may not be able to complete our task, which is, I was saying earlier, $10,000. What can I do with $10,000? Well, we've just got to do something. That's the point. And the more we do, the more change there will be. And the future of children is in our hands. Okay, this is our Break the Cycle faculty. And what I want to do now is introduce you to Kevin Lee. Kevin is graduated from Emory with a Bachelor of Science in Chemistry, a minor in Comparative Literature. He co-leads Sprouting Reader. This is the project he's going to present to you, and this is one of the presentations and projects from our 20th annual Break the Cycle program. I hand you over to Kevin Lee.
Thanks, Dr. Rubin. Okay, hi everyone. My name is Kevin, and thank you for the introduction, Dr. Rubin. Basically, I'm a graduating senior from Emory University. I didn't do this project alone. I was with Eva Lee as well as Micah Einhorn, and we're all graduating seniors. So you can kind of think of our work in Sprouting Readers as the accumulation of our past 3 years. And the title of my talk is Sprouting Readers and its Impact on Nutritional Knowledge for Children Living in Food Deserts. And Sprouting Readers is basically a division of Emory School of Medicine's Urban Health Initiative. And as a quick presentation overview, I'll start with a background of Sprouting Readers, then I'll move to a project description of our hypotheses and methods. I'll talk about our results and discussion, as well as future directions. And so at its core, Sprouting Readers is an after-school it's a community-based after-school literacy program that basically combines reading as well as STEAM lessons to push health messages into children. And you can kind of see that we're basically combining reading as well as STEAM lessons. STEAM stands for science, technology, engineering, arts, and mathematics, but you can assume it's kind of hard to push engineering and math with reading. But we also include this with intergenerational mentorship. So our volunteers with Sprouting Readers are anywhere from high school students we work with around Metro Atlanta, undergraduates, medical students, as well as faculty from Emory. And the main population that we're targeting, I guess, as Sprouting Readers are kindergarten to 3rd grade students who live in Atlanta's West Side community, primarily the zip code of 30318. And this is really important because Atlanta's West Side community is a designated food desert where about 1 out of every 3 people living in the West Side are over 1.5 miles away from the nearest supermarket. And this is a really big issue, especially when you're living in a big metro city like Atlanta. And yeah, over 25% of households in the region are food insecure. And one of our main sites that we hold reading sessions are at Agape Youth and Family Center, which is actually about 4 miles north of here. Our research questions and hypotheses are basically how effective is Sprouting Readers in improving health literacy as well as reading interest, and how can Sprouting Readers train our volunteers to achieve optimal progress for our students at all levels. And this is a very overwhelming slide, but this basically shows our current actions Sprouting Readers. We primarily operate at 3 sites around Atlanta. The first one is Agape Youth and Family Center, as well as the second one being Sarah J. Gonzalez Memorial Park. These are about a mile apart, and these are both located in Westside Atlanta, the designated food deserts in Atlanta. The third one is Clarkston Community Center in Clarkston, Georgia. And if you guys know anything about Clarkston, it's one of the nation's greatest hubs for refugees. And this cycle basically here shows how we hold our sessions. You can kind of start anywhere, but if you start at the bottom left, we mainly start with reading and discussing books either in small group or classroom-wide settings about gardening, nutritional and as well as, physical education. We always pair this with a STEAM activity that we align with Georgia educational standards by working with our center's educational directors. We also have a hands-on activity that's related to the lesson, and this is important so that we can spur creativity and lasting inspiration in our students. And then we also let the students go home with a book, as well as healthy snacks, as well as other incentives that they can, pass on to their families as well. And before we talk about what we did at, Dr. Rubin's Break the Cycle program, these are some statistics that Micah, Eva, and I have built over 3 years working with Sprouting Readers. And so in Metro Atlanta, we've served over 200 students across our 3 sites. We've worked with publishers and authors around the country to donate over 4,500 books to our students, and many of these are bilingual books, so both books that basically have Spanish as well as English text to cater to those children. We also have held over 450 sessions as of last month, and we have over 100 student volunteers, from high school students to undergrads to grad students to med students at Emory. And as well as beyond these numbers on paper, we've also been able to gain local news recognition. So Joan Wilson, who's our mentor, was able to publish an article and support a report not too long ago, basically to spread awareness about what Sprouting Reader does. We were also interviewed by reporters from Rough Draft Atlanta who came to our sessions at Agape and basically were able to see how we were working with children live. Okay, and so moving on to our assessments, I think for the past 3 years, we were able to look at the impact of Sprouting Readers qualitatively. This is through just parents letting us know how happy they are about their kids learning in these after-school programs. But we've never really had a chance to assess our results quantitatively, because you can imagine it's really tedious to create these questionnaires that are based not only catered towards these children, but also IRB approved. So when we started our Break the Cycle program, that's what we did. We first got IRB approval to develop these studies that measure nutritional, environmental, as well as education related to gardening related questions, and we worked closely with the center's educational directors to make sure these weren't actually bogus questions. Again, these questionnaires were targeted towards children who are from K to 3rd grade, and so we had to ensure that for these children, many of which had no prior exposure to this kind of content, so we had to make sure that these questionnaires were actually relevant to them. These are just an example of our tests that we gave about nutrition. These are, just pictures of our sessions of what we focused on. We read books that basically really emphasized, the healthy food plate. We did a lot of activities where we gave students the opportunity to draw their own food plate and talk to other students of what they thought were a healthy food plate. We've also, created our own presentation slides that basically get to the meat and bare bones of the information that what the children's basically need. Again, we're just going over the key concepts that are hopefully simple enough so that these children can remember them for years. Here are some questions that are related to gardening. So this is kind of like a big test that were given to these kids. It's about 25 questions, and these questions are related to gardening as well as their environmental stewardship. These are some pictures of sessions where we are focused about that. You can see that the books we're reading, we've gotten them from donations from publishers and authors around the country, and you can see just how enthusiastic these kids are at Agape. And lastly, here are some questions related to environmental conservation. Again, just more multiple choice questions that we gave to these kids at the beginning of the semester, as well as a few weeks ago as kind of like a post-test. This is just one of our activities where we let the kids write on the table. They have these really cool dry erase tables at Agape, where we basically ask them what was their definition of environmental stewardship and what they can do on a daily or on a day-to-day basis to basically, show this. And going back to the figure that Dr. Rubin brought up, we basically thought that Sprouting Readers was a really great fit for Break the Cycle, because you can kind of see that at every part of the cycle of health disparities, there is something that Sprouting Readers is doing, whether it's one of our actions or one of our impacts, that addresses one of the parts in our cycle. And so you can see that if you start from the bottom left at our healthy habits, what we're doing, basically fundamentally, is that we're teaching gardening, healthy eating habits, as well as what it means to be a good citizen to Mother Earth to these kids. And we're hoping that these are habits that will stick to them for a long time. You can see that for the section related to compounding factors, we're hopefully building confidence as well as self-sufficiency in managing personal health for these kids. For access regarding to nutritional foods, the effects of sprouting readers, we're empowering kids to eventually recognize and how to produce their own food as well as locate healthy foods when they're living in these food deserts. We're creating awareness through other programs and other initiatives by coming to programs like, here, as well as Break the Cycle, and going around the country presenting sprouting readers as a blueprint for other programs. And hopefully the ultimate goal is for children to take their knowledge home and spread it through the communities to improve community health. This slide here shows the assessment results. This was basically the 25 question pre-quiz that we gave to the students in January, and every single bar represents a student. So there's 15 students in the classroom at Agape, and then you can see on average the students missed about 6.8 questions across the nutritional, environmental, as well as the gardening questions. And then after the program, basically after the 11 weeks are over, actually a little more than 11, about 15 weeks, you can see that the children did significantly better on the exam, where they were only giving about 3 questions wrong per test. So this graph specifically shows how the students performed in the nutritional sections before and after the programs. For that 10 to 11 questions said about nutrition and nutritional health, the kids were getting around 3.5 questions wrong per test at the beginning of the semester, and then afterwards they were getting around 2.21 questions wrong. For gardening as well as environmental conservation, I think the kids found this a little bit easier. They were averaging 1.6 questions wrong originally, and then ending up with 0.7 questions wrong per test. The strengths and limitations of our programs are they're kind of interesting. So the strengths of our programs was that originally we were able to measure our success through qualitative measures, but now we had another route to measure effectiveness through quantitative tests. We're able to continue directly interacting with students, and by looking at not just nutritional but also environmental as well as environmental health, we can consider Sprouting Reads to be a really holistic program. And the limitations of our assessment mainly involve with the compounding factors of surveying these kids at Agape. So Agape is an after-school program where kids all around Western Atlanta come to Agape for after-school programs. So it's really hard to control for their different reading levels. Of course, there's external factors that are affecting and influencing their knowledge. And again, I think just having a 1-month window to run our program is obviously great, but we would obviously need a longer time window to see the greatest effect. Our future plans are basically just what I said. We want to conduct our quantitative methods through a longer period of time. We want to keep developing exams that are, that align with Georgia educational standards by working with our directors really closely, as well as identifying other external factors that influence knowledges. Our main acknowledgement is just thanking Joan Wilson, who's not here. She was our main mentor. She's the assistant director of Emory's Urban Health Initiative, who basically jump-started Sprouting Readers after noticing this huge literacy block in Western Atlanta. She's been a huge advocate for community programs for 30 years. Of course, I would want to thank everyone, including Dr. Rubin at Break the Cycle, as well as everyone here for Science for Georgia. This has been, a great experience. Here are our references, and that's pretty much it. Thank you, guys.
Oh, I have power. Hey, so guys, that was really awesome. Huge round of applause. Thank you so much. So yeah, does anyone have any questions or comments? Leslie has a question. Oh. Now it's just going to get awkward. We're just going to pass this back.
It's not so much a question as a comment. What Kevin showed was educating little children made a difference in their knowledge. And if you remember, when I was demonstrating which projects yielded major results, Break the Cycle, it's educating the youngest kids, because the younger you educate them, the more they have to grow and develop, and they will then become the guys who will change the world. So I appreciate your project. And Kevin's project with his team, they had a team of 4 of you. It was just fantastic, and an example of how each of the projects breaks that cycle. And I love your Break the Cycle diagram.
That's right. All right. Well, that was awesome. Yeah, Kevin, that was a really great example. We really appreciated you coming out here and giving that great talk. That was actually a really great talk too. Woo! Science communication. Patrick wants me to thank people, so I'm going to say a huge thank you to Wild Heaven West End for having us here tonight. And Science for Georgia would love it if you could join us for our monthly membership meeting, especially Michael because he runs them. And yeah, huge thank you to everyone. And I will leave it on the screen because you should come to this conference in 3 weeks. So huge thank you to Leslie. Also, I forgot this, but you have you always have that quote about just because we can't finish the task doesn't mean we're not obligated to get started. And I butchered it a little, but every time I think of things being impossible, I always go back to that quote. So thank you for introducing me to that quote because I put it in slide decks. Yeah, it's passed around a bit, but all right, Owen, please get involved. Sorry. All right. Thanks, everyone.